What's up, everybody? It's David. I'm your host of Highway to Health. Thank you for joining us. If you've tuned into this podcast, you already know that we love celebrating the people, the organizations that are committed to improving patient access, patient experience, and of course, the patient outcome. I'm in Austin today on the road visiting Omnicell and their brand new innovation lab. I'm fortunate to be sitting with CEO and founder, Randy Lips. Good to see you.
Great to be here, David.
And the Chief Product Officer, Nish Parekh.
Nice to meet you.
Welcome to Highway to Health.
Oh, glad to be here, man.
Oh,
This is it.
I'm lucky to be here. Look at this place. It's unbelievable. Why was an innovation lab something that was important enough to invest the time, the people in Austin, Texas, of all places? Why is this place so important?
Well, we have this big, audacious goal, and we think we really need to deliver to healthcare what we call the autonomous pharmacy. And what that's all about is let's get pharmacists back to doing pharmacy work, and let's figure out how all the administrative, the reporting, the compliance, all those other things, which is now 76% of their job, which has nothing to do with them going to school or anything. It's just overhead.
Right.
Let's let the autonomous pharmacy do that. The problem is it's a big goal. And if you're going to ideate and figure out a tough problem, you need a place where you can come and think and do that.
Well, this is a good place to do it.
Yeah.
And I mean, the location's not only is Austin awesome, and it's got a great healthcare community in Austin, but you're a stone's throw away from Dallas. You're a stone's throw away from Houston. Great healthcare hubs. I bet you're going to get a lot of feedback from your customers, your prospects, your partners. Is this place meant for your customers?
I think it is. And it's meant for our customers, not from like a showcase of all of our products, but it's meant for thinking through what's the next great thing. What are we missing? Here's a couple of ideas. What's wrong? What's right about it? And so it's very specific actions we're looking when we bring a customer through here. It's not let's show you a product line. We have other places to take people for that. But this is like we're working on really hard things. And I love hard things because that means it's going to solve a big problem.
And if you can do hard things, yeah, you're not going to have much competition either. I mean, not many people are looking to solve the big, hairy, audacious goals. What's your favorite part of this place?
My favorite, well, I have lots of favorite parts, but I think for me, what it comes down to is Randy started this company in his garage, and it was just meant to help in getting supplies to the right patients. And he kept going because he's such an entrepreneur innovator and figured out how to solve it for nursing floors and operating rooms and central pharmacies, and then ultimately all these outpatient areas. And when you get to that kind of scale and you're in more than half the hospitals in the US, how do you go back to the basics? And that's what this does. It's your garage that Randy actually once had in a little bit of a bigger setting.
It's a little bigger setting, yeah. But still has, concrete floors and tool sets everywhere. You can just tinker.
Yeah.
Break into it, right?
Mm-hmm.
Yeah, break it.
It's part of your culture. From what I understand, it's on your wall.
Yeah.
Yeah,
It's a place to break things.
absolutely.
What I like about it, I'll share my favorite part of this. We hear automation all the time in healthcare. It's a necessity. It's a need. We've got to start automating all kinds of tasks because not only are there shortages, but there's an increase in patient population like we talked about earlier. There's just not enough people to do it all anymore. And the people that are involved shouldn't be doing those tasks anyway. They should be focused on the most important thing, which is the patient. I love the physical or real world automation and artificial intelligence that I'm seeing here. It reminds me of what the general public might be hearing and seeing with a company that's not far from you, which is Tesla. You have experience in both software and physical or real world automation and artificial intelligence.
Yep.
What might be some of the unique challenges when it comes to the real world or physical automation compared to software?
At the end of the day, artificial intelligence becomes alive through data. And how you get that data is either through the software or through hardware. I would actually say what's better is when the data is coming from hardware, it's accurate because it's physical things that are happening that are capturing data elements and then allow you to put AI on top. With software, it's actually not as clean. You call it dirty data.
Right.
And so I actually find that you can get a lot more predictive analytics and a lot better AI when you have the hardware component in it.
That's interesting. I've never thought about it that way.
Yeah.
You know, in data or in software, we always talk about garbage in, garbage out.
Exactly.
The physical real world is less garbage,
Exactly.
more accurate. What's your experience with physical real world automation like we're seeing behind us?
Well, it's crazy stuff. First of all, there is the cognitive burden of people who are doing medication management. And can that cognitive burden be relieved because you either have the right software, hardware combinations? So if you think about it, one of the challenges in medication management is drugs expire.
Sure.
And so you have all these drugs on the shelf. So when you get the next dose, you want to make sure that it's going to expire sooner than one that's going to last longer. You want to keep that on the shelf. You throw it in a robot, you don't even think about it. It's automatically doing that for you and keeping you safe and keeping your drugs from expiring on the shelf or having issues. So there's no burden around figuring out all the drugs we need to throw out. It's always up to date. It's always making the right choice. You never have to think about it. There's no cognitive burden to understand whether you've got the right drugs in your hand as you're taking them up to the patient.
I mean, your customers have to love the idea of giving their professionals time back so that their population becomes healthier, happier.
Yeah. Well, just think about this. We're always talking about clinical doctor shortages, right, nursing shortages even more.
It's in the newspaper every day.
But there's 315,000 pharmacists in this country. And if you take about 3/4 of the work they do, that's over 200,000 pharmacists that are just dedicated to administrative work. What happens to healthcare if we take another 200,000 highly educated people and you take them from behind the counter or you take them out of the basement and you engage them with the patient? You have true outcomes. And this isn't a huge impact that can take place. I mean, that gets me excited.
Yeah.
It gets me excited.
You know, retention over recruitment. Those 200,000 are on the bench. It'd take a lot more work to go find 200,000 more, get them through 8 years of schooling, plus all the teachers and professors and things that it would take to teach them. So it's a big challenge.
Yeah.
And it's a big solution.
Yeah.
And the healthcare industry's got to love what they see when they come into the innovation center.
These are highly educated people who have lived through these workflows and issues all the time. And I think one of the things you understand when you go into these facilities, they don't have the time to sit back and get creative.
Yeah.
I just got to get through the day. This is a 24/7 live operation. I got to deal with my drug shortages. It's just, how can I make it through the day? Yep. It's not about, gee, let me be a little more strategic, think about the things I want to do, how to change it. They really need a company or an outside force to help them think through the things that are already buried in their mind.
Right.
And you get them into this offsite place and you start opening them up.
Yeah.
And they just start flowing because the ideas and things are in there. They just never get a chance to talk about them.
In the healthcare space said they're so busy working in their job, they don't have a chance to work on their job or in their business as opposed to on their business.
I love that.
And we talked about this earlier, Mish, where, you know, you guys aren't walking in, dropping a robot off, parachuting out.
No.
It's a true people process technology solution. Talk a little bit about how you're walking alongside these providers to make sure that this piece of technology, the solution, isn't an additional burden on the system.
You just talked about retention of people. You know, all of us, no matter what job you're in, we're always thinking about what can we do more? How do we elevate our role? How can we have a bigger impact? And now you start to apply this concept to what we do in robotics and automation. Randy just said 76% of people are doing operations. Well, when you start to put automation in, that means you're elevating their job. You're not getting rid of their job. You're saying, let the robot take care of it. Maybe then you can take a step back and come to this lab and think strategically, or you can take a step back in your health system and say, is it optimized in the best way? Where can I move drugs around to get them closer to the patient so I can make sure that a dose is never missed? So that's the people aspect. For me, the technology is then the process pieces, you're streamlining them. So maybe it used to take you 10 touches from the moment a drug landed in a hospital to when it got to the patient, changing your process with automation, maybe you cut that down to 3 touches. When you go from 10 to 3 touches, the chances of error, you've 70% reduced it right there.
That's great. I've had these kind of conversations. The things that get me excited about the healthcare space, been in the space 13 years. Everybody says healthcare is 10 years behind everybody else, every other industry. And I get a little defensive about that because it's like, well, you don't understand healthcare. There's reasons for that. You had a personal experience with your daughter that got you probably interested in healthcare, but you had professional experience outside of healthcare at American Airlines that I'm sure taught you lessons that you brought forward to Omnicell for the past 30 years. Talk about how maybe your time at American Airlines and outside of healthcare made this vision a reality.
I love to compare the airline to healthcare. There are 2 industries that are very similar. Safety is paramount, and this never should be questioned. Secondly, that there are a lot of expensive assets, airplanes, hospitals, equipment required to make those operations run. And then there's a lot of people involved, a lot of different types of job descriptions in airlines, a lot of different job descriptions and people in healthcare. And those processes and people have to come together to execute. And those have to be highly defined in an airline such that when a crew walks on an airplane, they don't have to know each other or ever worked with each other. They know what their assignment is. They know where their job begins and ends, and they can execute that flight because it's so well understood. Mm-hmm. And in healthcare, same thing. If you're in a particular process or procedure and you've got well-defined roles, you will execute well over and over. And that's some of the things I saw as a crack in healthcare. There was a lot of variation in practice. And the more we squeeze that down, the better off we are. But there's variation in process, and there shouldn't be variation in process. You should have a standard of care, which is, Toyota lean management. There is a standard, and everybody agrees to the standard until we agree that there's a better way to do it, and then you get a new standard. And so that's something that works really well in a lot of industries, and there's room in healthcare for that same.
My theory is people in healthcare are afraid to collaborate, to understand what the best process is, what the standard operating procedure should be. They define theirs and keep it to themselves, and everybody else does the same. What happens is variation leads to disparate outcomes. And the standardization is what's accepted and implemented almost in every other industry. Right? And healthcare should be the same. But collaboration is key.
Yeah.
And that's part of the heart of this innovation lab, is the collaboration that you talked about at the beginning with your customers and getting their feedback. I'm going to put you on the spot here a little bit. You're getting constant feedback. Yeah. I had customers in this place last night.
Yeah.
Today. Mm-hmm. As they're walking and talking, touching and feeling, looking, they're probably bringing ideas to you that you're already thinking about in terms of a product roadmap, a solution roadmap. Mm-hmm. How big is that collaboration going to be already being for Omnicell through the Innovation Lab?
It's been huge. So we launched the concept of an innovation lab about a year and 3 months ago with no space. It was in Michael Gorell's garage. Sure. It had already started there. And so what we did is we launched this thing called an innovation sprint process. Yeah. And basically in 6 to 8 weeks, we figure out very quickly, is that problem solvable and is it worth solving? Mm-hmm. But the point that I want to hit on that you mentioned is that's not coming from my brain or Randy's brain or Michael's brain. It's coming from the customer. So they're the ones that are telling us, this is a problem I have, and I can give you an example. Yeah. So last year, a few customers came and said, I have lost sight of my inventory in operating rooms. And it's because anesthesiologists, rightly so, need to be very quick and grab the meds they need because you have a patient on the bed. And so they're not tracking the inventory they're taking. Right. And so then when pharmacy comes in to fulfill the medications, the counts are always off. and they have to make multiple rounds and figure it out and then maybe order a different amount and it gets messy. And so we say, how do you solve for that? And so we ran an innovation sprint over 6 to 8 weeks and said, okay, the problem we have to solve is to make it really easy for anesthesiologists to be able to grab meds while tracking stays accurate. And so just yesterday, we launched a brand new product line called MedTrack. It's a launch of our RFID line.
Wow.
And it's
Congratulations.
Thank you. The product is MedTrack OR, and it allows anesthesiologists to grab and grow, and the technology automatically recognizes what med was taken, how much of it, and the pharmacist gets real-time updated so they know how much inventory to bring up. So that's a beautiful example of a customer bringing a problem, us trying to find a way to solve it, and then taking it to market.
Are we trying to take the human touch out of healthcare? And is the industry-defined vision of zero human touches going to remove the human element from the healthcare journey?
No, you want human touches, but at the right place.
All right. Okay.
And the human touch is moving something from point A to point B is not additive. What we want is the human touch is probably at the very beginning or the end of the process where they make the most difference. And if you look at an airplane, takes off, you've got the pilots all engaged in taking the plane off. But in many of the airlines today, it's company policy. They have to put it on autopilot as soon as they get to a certain height because it's going to save fuel. It's going to be safer, all these different things. The point is, let the automation do the best where it can, but at critical moments, you've got to have the human touch, particularly on things like administration. That's where you want to put the effort. Is this drug being administered right? Is it administered at the right time? All of these, is there some reaction that the patient may be having? So I need enough time to administer it right. I don't need to be going, I can't find the drug. I got to go run around. It's late now. I got to give it to the patient. I made the wrong decision because I was running around.
Yeah.
So if you think about it, and you brought up airlines, you could have a $25 part that can take a $200 million airplane off schedule. Very expensive.
Right.
You can't have all the parts of the plane, but you need to have the critical ones there when you need in order to execute. Healthcare has to have the same mindset. The meds have to be at the critical point when you need them. And then if you have to do too many exceptions, you're going to create errors, you're going to create problems, and you're going to cost money.
Yep. A 25 part keeping a $200,000 or $200 million plane on the ground leads to an expensive downtime for the airline. The analogy is the same for healthcare. Longer stays, readmissions are expensive for that, not only the patient, but the health system. And it puts in that queue of patients that's waiting to see a provider and to get care just gets longer and longer. I always thought financial services was the best comparison to healthcare. I think you converted me.
That's the airline. You got to go read it up on the airline. There you go.
If that's the industry defined vision.
Sure.
And that's kind of, on the horizon. That's the destination. What's the next biggest rock that we have to move to make progress towards that destination?
We talked about how healthcare is behind, right? You said you try to put that myth. Well, one of the reasons people think industry may think healthcare is behind is because let's just use this RFID example, okay? RFID is used in almost every industry. Let's say you go to Lululemon and you buy some leggings. Those are RFID tagged from start to finish. But if a box of clothing gets mistagged, it's not the end of the world. We don't have that luxury. We have to be 99.9% to 100% accurate. So I think it's not that healthcare is behind necessarily when it comes to moving us forward towards the autonomous pharmacy. It's that we have to be a lot more cautious and we have to be a lot more careful. And we have to get to certain thresholds to allow us to move forward. And so what's the next biggest rock? I think it's finding innovation in figuring out how to close the gap in that threshold. That's what's going to allow us to move a lot faster up that value chain.
We're in this golden age of innovation. Yep. I mean, not only here in Austin, but globally, really, in healthcare. Are we seeing an increased adoption of innovation and technology at the provider level because the technology has gotten that much better and there's more trust in that technology and that automation? Or is the mother of invention truly necessity, where these challenges like staffing shortages, increased patient population, reimbursement pressure, are those challenges necessitating an increased adoption? And the technology's got to come with it.
I have a strong opinion. I'm sure Randy does too, but I feel strongly that it's the latter. I think that innovation in healthcare is a necessity. And without it, we are going to see increased pain for customers, increased operational costs across the board, inefficiencies in process. So for me, it's if you're sitting here and watching this and you're in healthcare and you are not innovating, you are behind. You are insanely behind.
Take the other side of it. I think technology's gotten cheaper, faster. I mean, we just kind of, healthcare forever thought it was a big deal to get tied to a barcode. Put a barcode on a drug and it solves all these work. But you got to have scanners that work. You got to barcode it correctly. And it's a single critical item. But now you have vision systems. You have AI that can predict whether that's likely an error, whether the barcode's right or not. So you layer on these technologies on top of sort of these singular base systems like barcode, and you get from 6 Sigma to 9 Sigma. By the way, that's what airlines run at, 9 Sigma. They don't run at 6 Sigma, they run at 9 Sigma. Wow. Because small errors make big problems, right? Integrating technology into the process on multi-layers makes it so you can't get to the 99.9. If you're depending only on a barcode and hoping that one barcode wasn't misplaced, it's not going to happen there. But if you use vision, barcode, predictive analytics, and you're just watching data flows, like, gee, a doctor has never ordered this drug on that floor before. Oh, that's probably a mistake. I don't care what the barcode is. I don't care what the script is. That is just at the end of the bell curve. So most likely that's a mistake, right? Didn't have anything to do with other than what the data told me. So I think we can take all of these things and flow them in together. Yep. And then you run at perfection.
We've talked about a whole lot, from Tesla to airlines, to what you're doing in this awesome innovation lab. The people watching or listening are going to go home. They're going to tell their wife at the dinner table or tell their husband at the dinner table, I learned this one thing on this one podcast today. You won't believe it. What's the one thing you want the audience to walk away understanding and remembering and sharing?
I would say that it's innovation is, I strongly believe that to be an innovative person, to be an innovative company, it doesn't have to be large robots. What I would love for everyone to take away is innovation is a mindset, and it's a mindset of curiosity. So when we look to hire people, when we look to think about solving problems, we look for curiosity. And so be curious, ask a lot of questions, and that's how you'll become innovative.
I love it. Randy?
We're already seeing autonomous cars, even here in Austin, and even in the big factory down the street. They'll be coming out here soon with autonomous taxis that have no people in them. Right. The autonomous pharmacy is coming.
Yeah.
And you should celebrate that, because that's going to change the way medication management works. And what's going to be really cool about it is it's going to drive outcomes. Remember, in healthcare, almost every part of healthcare involves medications.
Yeah.
And getting medications right increases and produces better outcomes. And that's going to happen. And it's going to start this major step function of improvement in medication is going to be the delivering of the autonomous pharmacy. So it's coming soon. Better watch for it.
I love it. We're seeing it in every walk of life. And what's my favorite part of automation is it makes the humans better. And it makes humans more human.
Yeah.
Instead of your provider behind a screen while talking to you, let's get that out of the way. Let's bring the humanization back to healthcare. with more accuracy, more compliance, and at the right time. Thank y'all so much.
Well,
Thank you.
thanks for having us.
Absolutely.
Thank you so much.
Thank y'all.